Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Bilal from Bilal Herbal Healthcare Clinic and Al-Shaafi Academy, and today we are going to discuss hijama for neuronal diseases. And in this topic, inshallah, we will discuss those diseases which we come across commonly, like hijama for Bell's palsy, and then trigeminal neuralgia, diabetic neuropathy, nerve damage, optic nerve damage, hijama for epilepsy, and drop foot. These are the conditions which we are going to discuss today, and in this regard the first topic is Bell's palsy. So, as you know that Bell's palsy is a condition in which the eye is drooping eye, and there is loss of nasolabial fold and drooping corner of mouth. These are the symptoms, and then absence of forehead wrinkles and droopy eyelid or dry eye or excessive tearing, and sometimes the patient is unable to close his eyes, especially the affected side, and then there is facial paralysis or weakness, lack of sensations, drooping corner of mouth, dry mouth, impaired taste, headache, inability to close an eyelid, facial drooping in the corner of the mouth, drooling and changes in amount of saliva produced. There is an increased sensitivity to sound, and the patient feels pain behind the ear and pain around the jaw, and there is changes in quantity of tears produced also. So, these are the symptoms of Bell's palsy, and what are the causes why the Bell's palsy occurs. The direct cause is not known, but most of the cases are associated with viral infections, and these include herpes simplex virus like cold sores and genital herpes, and the herpes zoster, that is chicken pox, and is also termed as shingles, is also one of the cause. Epstein-Barr virus, cytomegalovirus infections, the adenovirus, that is respiratory illness, rubella, which is German measles, mumps virus, that is the mumps, and influenza B, that is flu, and Coxsackie virus, that is hand, foot and mouth disease, and there are some other reasons also, such as trauma, fever, tooth extractions, and the risk factors which can cause the condition of epilepsy include pregnant women who are in third trimester or in the first week after the delivery, diabetes, upper respiratory infections. All of them are the causes of Bell's palsy. Now, we will discuss the hijama points for Bell's palsy, and alhamdulillah we have seen great results with these points, and mostly the people are cured alhamdulillah within 3 sessions most of the time, if they have visited the clinic within a week or within 10 days or 15 days. The result of hijama is very much effective if it is performed within 10 or 15 days, the first 10 or 15 days. But even afterwards we have seen benefits of hijama alhamdulillah in this condition, and it gets cured completely. Although if we have started late, then it will take 3 to 7 sessions to completely cure. And the points at the back are 1 and 55, and on the neck, either side of the neck, on sternocleidomastoid muscle, the 43 and 44, and the points on the head are 32, 36, 110, that is just behind the ears, and 34 and 35 on either side of the head. So, these are the points on head and neck. And then we come to the points on face, because these are the most relevant points, and sometimes if it is not possible for us to start with the head points, then we start with the face points, because these are the direct points which are at the same site where the problem has occurred. So, on the forehead 101 and 102, 103 and 111, which is on the temple. This is the key point. This is the most important point in the treatment of facial palsy or Bell's palsy. So, 111, that is on the temple, and then the points on the cheek, that is 112 and 113, which is just beside the lips. 113 and 112 is near the ear, the front side of the ear, on the cheek, near the ear, and behind the ear, on the temples, and on the beside the lips. So, these are the key points of facial palsy. If the patient is going through hijama for the first time and he is a bit nervous or he is fearing the process of hijama, then and you want to keep the number of points as at least or as less as possible. So, you should go for these points first, that is on the face and on the behind the ear, and only the sunnah point at the back 1 and 55 should also be taken in the first time. So, these points, if they are done almost 3 times with the interval of 1 week, then it is very much sufficient to cure this condition. And alhamdulillah, we have seen many patients, maybe the number of patients who have cured from this condition with the help of hijama, it reaches to around 100 or more than 100. So, these are some of the important points which are very much effective for the treatment of facial palsy, and which we have been using for a long period of time, and we have seen great benefits. Now, we will discuss the treatment of trigeminal neuralgia and the way how hijama is used for the treatment of trigeminal neuralgia. So, the symptoms of trigeminal neuralgia are head pain, headache, eyes, there is pain behind eyes, and bloodshot eyes may bulge out and sensitive to sunlight, and the mouth discomfort is there and it is limited opening of mouth, inability to open smoothly, jaw deviates to one side when opening, locks shut or open, and there are some ear problems like hissing or buzzing or ringing in the ears like tinnitus, and decreased hearing, ear pain, and there are some problems related to jaw like popping jaw joints and grating sounds, pain in cheek muscles. There are some problems related to neck like of lack of mobility, stiffness, neck pain, tiredness, and there are some problems related to throat like swallowing difficulties, laryngitis, sore throat, and in the area of teeth there is clenching, grinding at night, looseness and soreness of back teeth. So, these are some of the symptoms of trigeminal neuralgia, and what are the causes, how is it caused. The causes of trigeminal neuralgia: the trigeminal nerve's capacity is disturbed, and the issue is contact between an artery or a vein and the trigeminal nerve at the base of cerebrum, and this contact puts weight on the nerve and causes malfunction, and it can occur due to aging, can occur due to damage to the myelin sheath covering certain nerves, and there are several triggering factors which may include shaving, touching face, eating and drinking, brushing teeth, talking, putting on cosmetics, experiencing a breeze, grinning and washing your face. So, these are some of the causes of trigeminal neuralgia, but there may be more than that. And then now we come to the point of hijama, how to treat this condition with the help of hijama. The points at the back are the usual points, which are 1 and 55, which are the main sunnah points, and the treatment for 72 diseases according to Hadith, and the 2 points on either side of the neck on sternocleidomastoid muscle, that are the 43 and 44, and then the points on the head are 32, 36, 34 and 35, and 110 on just behind the ears, and these points which are at the back of the head are actually targeting the cranial nerves, and as we know that trigeminal nerve is one of the 12 pairs of cranial nerves. So, we are targeting the origin of the cranial nerves, and then at the face where this trigeminal nerve is actually supplying the area of the face, that area is also covered by the points 101, 102, 111, 112, 113 and 108 and 109 sometimes. So, depending upon the area affected or the region of the face affected, we select the points on that area. So, these are the points for trigeminal neuralgia, and alhamdulillah we have seen great results with the covering of these points through Hijama, and alhamdulillah many patients have cured while they adopted only Hijama, because there is no major treatment options available for this condition. So, this is one of the neuronal diseases which we have discussed, and now we will discuss the treatment plan for diabetic neuropathy. And as we know already that the symptoms of diabetic neuropathy are numbness or tingling sensations, which begin usually from the feet, and then it travels towards the arms, and starting from the hands it reaches up to the elbows. And this loss of sensation and this numbness, feeling of numbness or like the dead skin, this condition usually indicates that the diabetes has been out of control for a longer period of time, and it usually requires control of diabetes. Very strict control of diabetes may hinder the progress of the disease, but it cannot reverse the disease itself. So, with the help of Hijama we have seen some benefits in the patients who are not suffering from this condition for a very long period of time, but those patients who have just started the symptoms and they are not suffering from this condition for more than 6 months. So, these patients usually benefit from Hijama in this condition, and the causes are, of course, as we have discussed, that the diabetes is one of the main causes, but other than that high cholesterol levels or uncontrolled blood sugar levels, smoking and alcohol consumption, and low level of vitamin B12 are also some of the causes which may cause the nerve damage, or the myelin sheath which is covering that nerve is actually damaged due to these factors. So, alhamdulillah, with the help of Hijama we have seen benefits in those patients who are experiencing diabetic neuropathy for a short period of time, like for example such as less than 6 months. So, the points at the back are 1 and 55 and 43 and 44 on either side of the neck, 11, 29, 30 on lower back, and these are the points which we usually cover for the sciatic nerve, or the nerves which are originating from the lower back and they are traveling all the way towards the feet. So, because these nerves are also affected, so their origin is also covered, and then we cover the directly the affected part, that is below the knees, on calf muscles and around the ankles, and one point which is 129 number, and which is situated on the dorsal part of the feet. So, which the location of that point is between the toe and the finger beside the toe, and just above a little bit above the position of toe. This point is located, and this is also one of the sunnah points which is also known as Zahar al Qadam. So, these points, if they are covered for 3 to 7 times with an interval of 15 days, they prove to be very beneficial for the treatment of diabetic neuropathy, and that is all for diabetic neuropathy. Now, we will go to the next topic, that is optic nerve damage. And as we know that optic nerve damage may cause blindness. If the optic nerve damage is around 75% or around 100%, then it is irreversible and the blindness is inevitable. But if the optic nerve damage is in the beginning and the patient is suffering from optic nerve damage because of diabetes or because of some other causes, for example, there are some primary causes like demyelinating optic neuritis and multiple sclerosis, which is an autoimmune disorder, and neuromyelitis optica. These are the some primary causes of demyelination. And demyelination means the myelin sheath is destroyed, which is covering the optic nerve, and it causes the permanent destruction of the optic nerve. And then there are some other causes which are including infections, vaccination, sarcoidosis, autoimmune disease, drugs and toxins. These are also the causes of optic nerve damage, and sometimes trauma is also one of the reasons. So, if there are any kind of causes, the symptoms are usually there is pain behind the eye, vision loss in one eye, visual field loss, loss of color vision or flashing lights. These are the common symptoms of optic nerve damage, and the patient is losing the eyesight gradually. And now the points which we cover for the condition of optic nerve damage are starting from the Sunnah points, which are the standard points 1 and 55 and 43 and 44. These are the standard points for all of the neuronal diseases. Now, the most important points on the back of the head are 32 and 36, 2 and 3, 34 and 35. So, these points are actually at the origin of the cranial nerves, and as we know that the optic nerve is also one of the cranial nerves. It is a sensory nerve, and this is actually this nerve is actually responsible for the eyesight. Whatever we see through our eyes is reaches through this nerve to the brain with the help of optic nerve. So, the points on the forehead are also very important, because this nerve is arriving from the which is originating from the back side of the head. It crosses the temples and then it reaches towards the eyes, and the points at the temples are also very important in this regard, and the points on forehead, above the eyes and below the eyes, like 101, 102, 103, 108 and 109. These are the most important points on the front side of the face. On the face and on the back of the head, both of these sides are very important for the treatment of optic nerve damage, and usually the results appear after almost 7 sessions and with an interval of 10 to 15 days. Now, we will discuss Hijama for epilepsy, and as we know that epilepsy is caused by, sometimes it is in the genes, and sometimes it is caused by some shock to the brain, or depression, anxiety, memory changes, hearing loss, learning problems, trouble solving problems, trouble focusing and trouble finding words, which are some of the symptoms also that the person is suffering from epilepsy. And the common symptoms of epilepsy are loss of consciousness, anxiety, staring, weakness and muscle contractions or jerking, which is the main symptom of epilepsy, and that is grand mal, which is also termed as grand mal epilepsy. Now, we will discuss the points for epilepsy. The points of Hijama for epilepsy are 1 and 55 and 43 and 44, as we have discussed the standard points, but in this case these are not just the standard points, but 43 and 44 are the most relevant points also in this case. And then the points at the back of the head, 32, 36, 2, 3 and 34 and 35. These points should be taken cautiously, because sometimes they trigger the epileptic response, they trigger the epileptic fit. So, you should select these points wisely and gradually, not at the same time, not all of the points. So, maybe 32 and 36 are the safe points, but the 2 and 3 are the tricky points. So, you should avoid them in the beginning, and first you should attempt 32 and 36, and then you should go on the front, and 101, 104 and 105 are the safe points, and we have seen great results with the help of these points, alhamdulillah. So, you should go first for 1, 55, 43, 44, 32, 36, 104, 105 and 101. So, these are the most important and safest points for the treatment of epilepsy, and alhamdulillah we have seen many patients. I would like to discuss a case of a child who was just 10 months old, and that child was suffering, that baby was actually, that infant was suffering from epilepsy from the time, I think that since 2 months or 3 months he was suffering from epilepsy, and the fits, number of fits was 50 during a day, and the doctors have told the parents that they could do nothing about it. So, they came to us, and alhamdulillah we performed only Hijama on 2 points, one on the head and one on the C7, that is 1 and 55, the location of 1 and 55, but we took only number 1 and on the head 32. And after the first session of Hijama, the child, the baby who was suffering from fits, around 50 fits in a day, his condition was so improved that after that he encountered only 4 fits in a day, as compared to 50 fits in a day previously before Hijama, and after Hijama he experienced only 4 fits throughout the day, and then after 2 or 3 sessions, alhamdulillah he got cured completely. So, Hijama is very beneficial for the treatment of epilepsy, and even more if it is performed in the early age, as early as possible, because Hijama is safe in the treatment of even the infants. or even the newborn babies. So it can be performed safely, and there are several precautions which can be practiced to make the process safe and without any complications. Alhamdulillah, the results are obtained. Now, the last condition which we are going to discuss today in the neuronal diseases is the hijama for drop foot, and drop foot is also a condition where the nerves are damaged, and due to that there is loss of control on the position of foot, and the person cannot retract the foot, or cannot fold its foot, cannot fold his foot, or cannot lift the foot. So usually some interventions are applied, some physical interventions are applied to manage this condition, but there is no treatment available so far. But alhamdulillah, we have seen very good results with the help of hijama in many of the patients. Not all of the patients, but in many of the patients we have seen great results, alhamdulillah. So the symptoms usually begin in late childhood or early adulthood: foot drop, which is inability to hold foot horizontally, and claw toe, which is curled toes, weakness in the hands and forearms, loss of touch sensation in the feet, ankles, legs, hands, wrists and arms, on and off pain and spasmodic muscular contractions, high arched feet. These are some of the symptoms of drop foot. So the points which we cover for the treatment of this condition are 1 and 55, 43 and 44 standard points, and then the points at the lower back 11, 29 and 30, which are actually on the location of L4, L5, S1, and then the point on the ankle, that is nearest to the affected part, and then the points on either side of the ankle, and then just above ankle or below the knee, and on the lateral side of the foot, and then the point on the foot, that is the sunnah point, dorsal side of the foot, that is 129 number. So 129, 132, 131 and 63, and the point which is on the lateral side of the 63, that is on the lateral side of the calf muscle, which we have named that point as KBS. So these points should be applied, and they should be repeated till 3 to 7 times, and alhamdulillah, we have seen great benefits in many of the patients, at least in 40 out of 100 patients. So alhamdulillah, this is also a good response because there is no other option available. So hijama should be performed on these patients for the treatment of drop foot. So that's all for today, and we have completed our topic of neuronal diseases. Inshallah, we will see you soon with another topic. By then, assalamu alaikum warahmatullahi wabarakatuh.